Imagine being born with joints that don't move as freely as they should, or perhaps they're even stuck in one position. This is the reality for individuals with a condition known as arthrogryposis. It's a fascinating yet complex disorder that affects joint and muscle movement right from birth. Today we're going to explore what arthrogryposis is, why it happens, how it affects the body, and what treatments are available. By the end, you'll have a complete understanding of this condition. So let's get started. Arthrogryposis, also known by the longer term arthrogryposis multiplex congenita, is a rare condition that affects the way joints and muscles develop in a baby before they're even born. Essentially, a child with this condition is born with multiple joint contractures, which means their joints have limited movement or might even be stuck in one position. Imagine trying to bend your arm, but it just won't go beyond a certain point. That's what these joint contractures feel like. The muscles around these joints are often affected too. They can be thin, weak, stiff, or sometimes even missing altogether, and sometimes there's extra tissue that forms around the joints, holding them in place and making it even harder for the joints to move. The most commonly affected areas are the arms and legs, but it doesn't stop there. The condition can also impact joints in the jaw and the spine, making it even more challenging for individuals to move freely. The root cause of arthrogryposis often boils down to something called fetal akinesia. This term means that while the baby is developing in the womb, they don't move around as much as you'd expect. Now, movement is incredibly important for developing joints, muscles, and tendons, kind of like how exercise helps us keep our bodies flexible and strong. If a baby doesn't move much during pregnancy, those joints and muscles don't develop as they should, and extra tissue can form around the joints, making movement even harder. Arthrogryposis isn't a one-size-fits-all condition. There are actually different types, each affecting the body in unique ways. Children with arthrogryposis have a wide range of symptoms, and these can vary significantly from one person to another. Some children might have only a few joints affected and nearly normal movement, while others may have many joints involved, making movement much more difficult. If a doctor suspects a child has arthrogryposis, they'll start with a thorough physical examination. They'll look closely at how the joints are positioned and how much movement is possible. They'll also check for any other features that might indicate a more complex condition. While there's no cure for arthrogryposis, the main goal of treatment is to help children gain as much movement and independence as possible. Physical therapy and occupational therapy are incredibly important and often start right after birth. These therapies are designed to help stretch the muscles, improve joint flexibility, and teach children how to use their bodies in the best way possible. Arthrogryposis is a complex condition that affects how joints and muscles develop and function, but with the right treatment and support, many children with this condition can lead active, fulfilling lives. They learn to adapt and find ways to do things that work best for them, proving that there's no one way to experience the world. If you'd like to learn more about conditions like this, or dive deeper into medical topics, make sure to check out the King of the Curve app. It's a fantastic resource with quizzes and interactive content to help you master complex topics just like this one.